Meanwhile, Democrat Hannah Pingree, who is running for governor, is sharing her concerns for the health of women and infants as more Maine hospitals close their labor and delivery units. In a statement to the Maine legislature, Pingree says Maine has lost 12 birthing units in the last 10 years. She says this is preventable and requires the state to take action through policy. Pingree's comments come while a group of legislators hold a public meeting in Augusta. Our Drew Peters gives us the details.
Here at the Cross Building, legislators, healthcare providers, and community members are coming together to discuss possible solutions, as well as concerns about what will happen if Maine's maternal centers continue to close.
The birth of your baby or the start of their life is going to be in this place that's sort of dying.
Since the announced closure of Maine Health's Lincoln Labor Delivery Center in Daramuscata, Cecilia Ackerman and Bailey Romaine have been left wondering how their children will be born.
My entire pregnancy, I've been fighting to not let the fear and sadness and anger of this overshadow my happiness.
Concerns they're bringing to a community forum hosted by the State Committee of Health Coverage, Insurance, and Financial Services.
We're all a part of the problem.
Hoping to address the issues that Maine Health and other medical providers say are making it nearly impossible for maternal centers to stay afloat.
It truly was the ability to recruit and retain providers.
Lincoln Hospital Director Cynthia Wade and members of Maine DHHS arguing that Maine's dwindling birth rates, higher number of complex birthing procedures, and lack of financial incentives lead specialty care providers like obstetricians to look elsewhere.
We have to adapt our systems to accommodate the lifestyles of the physicians who are now coming out of school.
State Representative Robert Foley says investing in incentives like loan reimbursements for incoming medical workers and programs that bring maternal health care training closer to rural communities could be a step in the right direction.
To incentivize folks to go there, stay there, and make their homes and their practices in those part of the state.
Fellow Representative Sally Clucci arguing that the state and healthcare providers should be directly funding alternative ways of providing maternal care through telehealth services, midwives, and family physicians.
Different levels of providers, people with different skill sets, all sort of coming together to complement the team.
We should consider labor and delivery services as essential, and they shouldn't be looked upon as something that can be just cut.
The group of legislators say they'll continue discussing on how to implement these potential solutions as the next legislative session in December draws closer. In Augusta, Drew Peters, News Center, Maine.